Hey family, welcome to Createdverse, the podcast where we dive deep into Christian ideas, thoughts, and beliefs, always aiming to explore them through a biblical lens. Whether you're a longtime believer, new to the faith, or just curious about what Christianity teaches, Createdverse is here to journey with you, offering fresh insights and thought-provoking conversations. Today, I'm thrilled to welcome Dr. Jill Rovaris. She's a counseling psychologist and the CEO of iWILL Till I'm Well Medical and Counseling Services, where she advances rapid human-to-human access to medical and mental health support. Across nearly 40 years of leadership, Dr. Jill has served in senior roles at the University of California, San Francisco, Santa Clara University, and Tulane University. She chaired the Louisiana State Board of Examiners of Psychologists, contributing to regulations that safeguard quality care. As founder of the Jill Foundation, she has created programs in violence prevention, rape crisis response, and mental health access. On Createdverse today, I'm hoping Dr. Jill will bring a clear, practical introduction to what mental health is, why it matters, and how integrated mind, body, and spirit support can help someone take a step to mental freedom. Dr. Jill, thank you so much for joining today on Createdverse. I'm so thankful and grateful for your time and the wisdom you'll bring to today's episode.
Thank you for having me. It's an honor to be here. Thank you.
Absolutely. So for our program today, Dr. Jill, just to kind of walk through, I hope we can begin this conversation by clarifying what exactly mental health really means and why it matters in everyday life. After that, we'll walk through your iWILL Till I'm Well model, what it is, how it works, and a few actionable tools our listeners can put to work right away if they choose to utilize your provided services. So, so before we begin, I guess, if I may, can I give you a couple definitions I found online that defines what mental health is, and if, in your professional opinion, agree with this or would add on to this, or even alter the definition that would better harmonize to the tone of our current conversation. Is that fair?
That's fair.
Excellent. Okay, so I found two good definitions. So one, I went to the World Health Organization. It defines mental health as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It has an intrinsic and instrumental value and is integral to our well-being. So that's one definition. Then I went to the CDC, which is interesting definition as well. So it defines mental health as mental health is the component of behavioral health that includes our emotional, psychological, and social well-being. So mental health is a state of well-being that enables us to cope with the stresses of life, realize our abilities, and learn well and work well and contribute to our community. So when you hear these WHO and CDC definitions, what feels exactly right and what feels incomplete? And as you answer that, maybe you can give us maybe a better definition of mental health as well.
Yeah. So when I hear that, I know that the WHO is more than the absence of a disorder or the absence of a disability. So it's saying that mental health kind of exists on a continuum, right? It's experienced differently across individuals. And that feels right, so the well-being beyond the absence of a disorder is good. So that definition, both of those definitions, kind of emphasize that mental health is more than just not having a diagnosis, which is great. They both emphasize a proactive sense of wellness, identity, sense of purpose, and it talks about holistic functioning rather than purely reactive illness or illnesses. It realizes in those definitions that abilities are learned. They learn well, we work well, we contribute to our community, as WHO said, and similarly for the CDC. So it's not just about the symptom or symptom reduction, it's about thriving. So that's what I really like about those definitions. And it also talks about a continuum and inclusivity, which is great. So the idea that mental health lives on a continuum is great. That means it allows your work to avoid any kind of binary language like illness versus, I mean, healthy versus unhealthy, well versus ill. So it goes beyond those dichotomies, which is great. But what feels incomplete or that might we might want to expand on is the spiritual aspect of mental health, right? The transcendence
Mm,
dimension, like spiritual well-being, our purpose. So, we should include in these definitions a sense of identity, a sense of culture, a sense of a cultural or existential development. So the definitions, they speak to ability, they speak to coping, they speak to work, but they don't speak explicitly highlight identity formation. They don't explicitly highlight existential meaning, cultural or historical trauma, right? Or the
mm,
interplay of our identity, like our race, our culture, our faith. They don't integrate all of that with mental health, and all of that plays a part in our mental health. It determines who I am, where I belong, what I do. It's a core of who I am. And those definitions don't foreground that in their definition. So I think we can do better with that. So I don't want to talk too much on any one subject, but a
mhm.
question. I'm going to let you ask more.
Yeah,
Um,
that's interesting actually, because on your website, of course, being this spiritual kind of podcast talking about Christian thoughts, you said that on your website says that our mission is to provide accessible, compassionate, and innovative care that empowers individuals to take control of their health with
mhm,
a faith-driven approach and a
mhm,
commitment to excellence. And
mhm,
I like that because not only do I take a spiritual approach to most of my things and outlook on life, but I
mhm,
like how you are redefining healthcare to be more personal, holistic, and impactful.
mhm,
And that's one of the things that caught my eye, and which gives me reasons why we're talking today. Because when I look at your work through a theological level, I truly believe that Christian hope isn't denial, it's direction.
mhm.
And so God doesn't promise a life without valleys, but he promises presence in them. So as it says in Psalm 34, that the Lord is near to the brokenhearted. So I'm
Mhm,
looking at what you just said, this idea of proactive wellness. What
mhm.
does that look like? And it's not really a fact that you lack something, it's not a lack of faith, but it's a stewardship of the life that God entrusted to us. So
Right,
small, faithful steps, I believe, are how hope puts on our shoes, right?
right.
And so I like that, how you describe that on your website.
Mhm,
To continue that thought, I'm wondering when, and I'm learning about mental health. I'm brand new at it, so I'm learning more about it. And that's why we're having this conversation. So I'm asking this question: when do everyday struggles become signs of a possible disorder? Meaning, what's the line between a hard week and maybe a time to get evaluated? Does that make
Yeah,
sense?
yeah, it does. Um, and just to kind of solidify your point,
Yeah.
spirituality is an extremely important point of mental health.
Yeah.
But when do everyday struggles become a sign of, you said, a possible disorder?
Yeah, yeah, like I'm wondering, okay, I had a hard week today or a hard week,
Hmm.
but if I see consistency,
Hmm.
when should I think that it's time to get evaluated?
Let me give you a core idea.
Yeah, please.
We're going to call it the three Ds:
Okay, good.
duration, distress, and disruption.
Okay.
So everyday struggles become signs of a mental disorder or possible mental disorder when they last too long, when they hurt too much, or they interfere too deeply with our daily lives. So when you have a marker of duration, distress, disruption, let's take duration. So a typical hard week is when stress or sadness lasts a few days or maybe even a couple of weeks, but then it eases with rest and support or change in circumstances, right? So it can be
Mm,
ever present for a moment of time, but we have recourse to bounce back. It becomes a possible disorder when these feelings or these symptoms, they persist for 2 weeks or longer, and they're worsening over time, and we're not able to return to our baseline. So things are not improving for us. That's a sign that we're possibly going into a disorder when we don't have that ability to bounce back. And then, so that's duration. So, how long is this enduring, and can I continue to bounce back? And then you get distress, the second D. In a typical hard week, you get upset, you get irritable, you get anxious, but you feel moments of relief and moments of joy and moments of peace. When it becomes a possible disorder, we get um, we get emotional pain that feels constant. It feels heavy. It renders us with a spirit of hopelessness. Um, and little things brings relief, but not enough, right? So it's not sustainable. The distress is just too heavy, too
Mm.
much. That's when it borders on, hey, something is wrong here. And then the third D is disruption. So, during a hard week, you may be tired or distracted, but you still manage to work, to go to school, to maintain relationships. But when it becomes a possible disorder, is when our sleep is disrupted,
Mm.
our appetite is disrupted. Um, we eat with we eat our emotions, or we withdraw from foods, or we can't function. Our motivation wanes. Our relationships are constantly or consistently impaired. And daily life feels like it's just too much. It's just too much. So that's when there's a difference between a hard week and a possible disorder. It's all about functioning. Can you function? If you cannot function, the less ability you have to function, the more it's pointing towards you should seek help, right? And so a rule of thumb is, if your emotions or your behaviors start running your life
Hmm.
rather than helping you to live life, it's time to talk with someone.
Okay. All right. So I got you. So I believe you're pointing at a really important clinical and ministry idea. So when someone is struggling, we don't just ask, are you okay? But you're saying we look at three things: duration, distress, and disruption. Is that
Mhm.
correct?
That's correct.
Perfect. Wonderful. That's great. Thank you for sharing that. That's very insightful. Um, yeah, just a personal note, I live in over in Seattle, Washington. And so why I find this topic so important is because every time it seems like it's a very um, prominent discussion everywhere I go. Mental health, mental health, but everyone has a definition within their own perspective. And that's why I think it's very important for us to have these conversations so we can be more concise in our
Mhm.
definition so that we can move forward within our growth. So that's very important. As you're thinking or talking and thinking, I'm kind of curious on terminology. Do you prefer mental health, mental well-being, or emotional health when it
Mental,
comes to this conversation? Yeah.
yeah, mental health,
Hmm.
emotional health, or mental well-being.
Yeah, because it seems like those are the terms that people throw out.
Yeah, I prefer personally,
Yeah.
I prefer mental health over the
Okay.
other two. Um, and let me tell you why.
Yeah.
So, mental health is the overall functioning of our mind, how
Hmm.
we think, how we feel, and how we act, right? And if you want to kind of port that over to a spiritual realm, that's the soulish realm of
Yeah.
us, right? How we
Right.
think, how we feel, how we behave, right? That's where
Hmm.
all of our decision making, um, decision, that's where all of that is navigated. So
Yeah.
I consider that mental health. Mental well-being is the experience of feeling balanced or
Mm.
thriving. And then emotional health, I find to be the ability to identify, express, and regulate your emotions. So, mental well being is the experience of being in the moment, the feeling, the balance of it. Emotional health, shortly said, is the ability to identify things, to express and regulate our emotions. But mental health tends to include both the mind, the emotions, and the actions or the behaviors. But the important thing, Matthew, is how they relate.
Hmm.
So I like to think of them as like um, concentric circles, right?
Okay. Hmm.
So emotional health sits inside of mental health, which in turn shapes our overall well being. So the core of that would be mental health. Emotional health sits inside of our mental health, turns into, and mental health turn, and together they turn into our overall well-being. So emotional health kind of is like the inner weather of us, our moment to
Hmm.
moment feelings and reactions to things. Our mental health is our climate, the pattern of our thoughts, the regulation of our thoughts, the regulation of our identity, the ability to adapt. And well being is like the ecosystem, how our mind, spirit, and body and environment sustain itself within an environment. So they interact constantly, but they're not identical. Does that make sense?
Yeah, that does. Yeah, it's a very interesting way you put it. Yeah, I like that. That's I'm gonna have to think about that. Next time we talk, I want to kind of blow that up a little bit. Yeah, I'm a systematic theologian, so I really like walking systematically through things, and I think that helps us better understand exactly how to process it and to live it out.
Yes.
One thing being a millennial, I know that my emotions and feelings have definitely overclouded my judgment of my reality a lot. So how as I grow spiritually mature, I'm trying to think well. And thinking I'm finding is an art. You have to sit and actually give yourself time to think. And am I approaching this, whatever life throws at me, am I approaching it correctly? Am I responding correctly? And is the outcome is what I expect? And I think that's something that you're talking about. I think that all encompasses in those three ideas. So yeah, thank you for sharing that. Um, yeah, so before we lose so much time, let's transition to your medical and mental health care system. So, can you walk us through your I will till I'm well model? And before you do that, how'd you come up with the name? Just tell us the background of it, about it, what it is, and how it works, and then we'll go from there. That'd be great.
Well, as you know, I'm a psychologist and I have
Mm-hmm.
worked in peep. God has allowed me to peep into the souls of many people, right?
Mm-hmm.
It's a very sacred place. It's highly confidential. And then, the law comes and says you can't share it because it's
Mm.
so sacred, right?
Yeah.
Which is great. But I've seen a lot of people come to counseling with a reason. They needed a reason outside of themselves. Mama made me. I don't want to be here. Um,
Yep.
my dean made me. My teacher made me. My professor made me. And then they come and they enjoy it, but they enjoy having that say that I'm here not on my own will, right? That's all the stigma. I'm here because
Mm-hmm.
so and so and so and so. They don't have the power to say, I'm here because I need this. And so, after working so many years in this field and helping people to understand that this is for you and you're doing it for you and it's okay. So, it's I will. It's a declarative statement. I will take care of myself until I'm well.
Mm.
So, it's personalizing your healing. It's empowering you to say, I will do whatever I need to do until I'm well because I am important to me.
Mm,
So,
I like that. You're taking ownership. You're
taking
saying I am becoming an active participant within my own well-being. I like that.
exactly. Yeah,
That's good.
exactly. So that's where the name comes from. Um, Gosh, Matthew, there's so much happening in the world today. I mean,
No,
we don't have
that's a
time to
lot.
talk about the stats, but maybe in a later episode we can
Yeah,
dig deeper into the statistics around the shortage of mental health professionals,
yeah.
the demand for mental health care, the rise in insurance cost,
Mm,
all the people that are being put out of work.
yeah,
Um, I mean, so to me, it's tragic. We came up with this model in 2019, right before the pandemic hit. Um,
that's I'd say coincidence, but
yeah.
I don't believe in those.
Yeah, right. Yeah, I think
Yeah,
everything is purposive. I agree with you.
yeah,
We may not always know what the purpose is, but everything
no,
has a purpose.
yeah, that's true.
Yeah. And so we came out with this model, and basically, um, it's now God has prepared a time where it is very, very important here during this day, in the sense that what our program offers, I don't know of any other telehealth company that's offering what we're offering, right? So it's a
Mhm.
combination of services, but it's also the cost of our services. It's accessible, it is
Yeah.
affordable, it is reliable. And so what we're offering is three platforms. We have a medical platform, we have a mental health platform, and we have a televet. We call it televet, but it's a pet care platform.
Yeah.
Um, and so because we feel like animals, our pets are part of our family, right? And they help us with our psychological well-being and our physical well-being. On the medical side, I'll start there real briefly. We offer 24/7, 365 days a year access to a medical doctor.
Wow, that's
Any
impressive.
day, any time, right? But it's a medical doctor for your urgent care needs.
Yes.
You get the flu, you get COVID, you have
Hmm.
GI problems you don't understand. You could pick up the phone 2, 3 o'clock in the morning
Hmm.
and get a call back from a doctor. We say, Matthew, within 2 hours you get a call back, but it's usually probably around more like 10 minutes, 5 to 10 minutes, sometimes less. So we talk about a buffer to make sure you get that call, but our callback comes fairly quickly. And you get to talk to a medical doctor. We don't have nurse practitioners, we don't have physician assistants. All of our medical personnel are medical doctors, 24/7,
Mm.
365 days a year. Then we offer you primary care. So you can say, well, I just want this urgent care model. I can speak to a doctor anytime. You can also choose a primary care doctor where you can select the doctor you want to work with. So you select your virtual primary care doctor and you can set an appointment to meet with your doctor anytime between 7 a.m. and 7 p.m.
Mm.
Um,
That's
Monday
interesting. And a
through
question on
Friday.
that. So, my question was, how do you match people with the right clinician? So you just give options,
We
and
give them
then
options. They choose.
interesting.
Yeah, they
Very
choose. And if
nice.
they didn't like that option, they can choose another
Mm.
doctor.
That's
Um,
great.
so you get to choose the doctor that you want, and you get to then schedule an appointment. And on a primary care model, Matthew, they
Hmm.
handle more of your chronic illnesses. So it's more like a chronic disease management, so
Yeah.
diabetes, hypertension, any kind of disease that you're experiencing that requires more intense care. So you
Yeah.
would want our primary care doctor. We also have care coordinators who will help you 24/7. You can call a care coordinator. They will help you schedule your appointment. They'll help you with some community referrals if you need it. They will help you even with if you have insurance. Oh, by the way, you do not need insurance to get on our platform. But if you
Mm.
have insurance, we will help you manage your EOB. Um, if you need a specialist or if you need x-rays, then our care coordinators will help set that up for you in the community. You get to meet with a dermatologist 3 times a year. You get a comprehensive metabolic panel at least once a year. And if your physician, your doctor says, well, you need these extra labs, then we will give you the cost of those labs at a greatly discounted rate. Or if you have insurance, you can use your insurance to pay
Mm.
for that. Um, let's see, on the medicals, I'm sure I'm not looking at it, Matthew, so
Yeah.
I'm probably not remembering it all. But let me just jump in the interest of time to our mental health platform,
Yeah.
which I feel is very robust. Um, and our new model, one of our models is self-care is the new healthcare.
Mm.
So self-care is the new healthcare. So let us help you establish the care that you need the way you want it. And we reach out to people who don't have access to care. That's the beautiful part of it. So our mental health program, we have crisis management, we have short-term therapy and long-term therapy. A lot of telehealth companies do not handle crises. They'll tell you if you're in a crisis, call 911, go somewhere
Yeah.
else. This is not designed. We are designed to handle your mental health crisis. So if you're suicidal, if you have any kind of threat to harm yourself or another, call
Mm,
us. Now
that's
we
wonderful.
may involve, the authorities within your area because we have to
Yeah.
do what we ethically need to do to keep you alive. But we work with that. If you have crisis that you just need managed, it's not life threatening, but you just need to talk through something, we can help you with that. We also have, Matthew, what's known as in the moment care. So we
Mm,
have like a bank of therapists, counselors who are standing by, just waiting for you to call them. So you could
mm,
pick up the phone anytime. Let's say you go to a party and something happens and you have anxiety. You can go to a private place, wherever you find is private, call and talk to a counselor. They will help you to process that. If you have a therapist and something happens in between your appointment times, you can't wait till your next appointment, pick up the phone, call and talk to a therapist 24/7, that part.
wow. And
Um,
what safety and privacy protections are in place?
we have HIPAA compliant. So
Mm,
all of your
okay.
records are 100% compliant and protected. Your privacy laws are respected. No one can see your records but the provider.
Wow, that's incredible.
So it's highly confidential. Um, So in the moment care, crisis care, we also have short-term therapy
Yeah.
where you can select your therapist and schedule an appointment to meet with. We have two models. We have a model where if you are highly structured and you need predictability and you want to know how many sessions this is going to be before you go into the work, we have a highly structured model where it says you get a maximum of 8 sessions. That's it. And after the eight
Mm,
sessions, then if your issues are not resolved, we will refer you to the community. The care coordinators will step in and help you to find someone in the community. If you are therapy savvy, you're used to this, you feel like you want your therapy set not as structured as that, but according to what your issues are, we
mhm,
have counselors who are willing to structure or have you with a clinically determined number of sessions. What that means is I present my issue to you, and the therapist says to me, well, I think it'll probably take us like 15 weeks to get through this. So it's not a hardcore number. It is a number that's significant to your presenting issues. So those are the two short-term therapy models we have. And then for our long-term therapy, let me back up a little bit. In our short-term therapy, Matthew, if the counselor you're working with is in your vicinity, you can go into their office. So it can also be in person if the therapist is in your area for the short-term model. For long-term therapy, we have a host of psychologists and psychiatrists. So
mm,
you can meet with a psychologist as many times as you like. You can meet with a psychiatrist for as many times as you like. The difference there is at a discounted rate, and those monies do not come to iWILL Till I'm Well. They go directly to the providers. So you can meet with a psychologist. I'm a psychologist, so I know that this is a tremendous discount. You can meet with a psychologist at a discounted rate of $100 a session.
great.
I
Mm,
charge much more than that.
yeah.
And then you can meet with a psychiatrist for your medication management, where you get the first session is at $215, and then every session thereafter is $100. That is a tremendous bargain.
Wow.
Now, if you have insurance, you can use your insurance in the community, but not here. But
Mm,
a lot of professionals in the community, what they do is you meet with them, you pay them full price. They give you a receipt, and then you're to take
okay.
that to your insurance provider, and then they will reimburse. So we do that. So for these discounted rates, you get a receipt, you can take it to your insurance provider. And then we have televet, where we have a consultation service. So if something is wrong with Fifi or Travis, you can call and speak with a veterinarian, and they keep you out of the hospital. They keep your animal out of the animal hospital. They keep your pet out of the vet clinic. Because, once you cross, I don't know if you have an animal or a pet, but they are very, very expensive, and we panic and we bring them to the vet, and that's a big dollar ticket.
Yeah.
So we help you to not go into the vet, or we tell you, what, this situation, you should bring Fido to the veterinarian and have them checked out. We also have a pet discount card, right? So if you get meds, you need to get meds for your furry family member, you can use the card. Now, here is the last thing, and I'm going to tell you of the special that we're running. Medications are so expensive. So we have a formulary of over 1,000 acute and chronic medications. If you have high blood pressure, diabetes, and you're on these medications, we have a plan that if you get a subscription to this plan, which is $20 a month, you can get over 1,000 medications at no cost. You pay $0 for it.
Wow, that's incredible.
Yeah. And so what I said to you, all that I said to you, if we were to bundle it, Matthew, it comes at $75 for the family,
Great.
a household,
Yeah.
A month, with a $25 copay every time you meet with your primary care physician. So you get urgent care, primary care, you get all of the mental health platform for $75 a month, with a $25 copay every time you meet just with your primary care physician, not urgent care, not mental, just your primary care, which I think is a great bargain, right?
Indeed.
But because times are so hard, and we're coming upon the holidays, even when we were financially stable, if we're not now, the holiday season brought on stress, right? Yeah. So the economy is not as stable, but we are approaching the holiday season. So we want to help families in the name of God. So we are spiritually driven. We believe that this plan is all about what God wants us to do. So that whole package that I just mentioned, urgent care, primary care, visits to the dermatologist, care coordination, mental health, short-term, long-term, in the moment care, not the pet, all of that, we have reduced it for a short period of time by 60% and removed the copay. So what that is, we're offering this for $30 a month.
Wonderful. Well, sign me up.
Yeah. The only thing
great.
though is you have to do a minimum of 4 months. So $120, you get all of what I mentioned. You can't even buy a pair of Nike shoes for that,
Yeah, you can. And so we only have about 2 minutes left. So if a listener wants to use iWILL till I'm well, medical and mental health care solutions, what are the exact next clicks for them right now?
So if they go on our website, they'll see sign up, register here, learn more, all of that. And that'll take them to the pricing page, which they get to choose either, do they want just urgent care? Do they want urgent care and mental health? Do they want our premium package? I just described to you our premium package, right? That's $60 for the individual, $75 for the household, up to 8 people. Our household is up to 8 people within your household. They get all of this. So, but if you want the special that I'm talking about for $30, you have to send me an email, Dr. Jill at iwilltillimwell.com, and say, I am interested in signing up, because then we have to give you a code so that you can override that $75 that's on our website. Limited time, great offer, anointed to help God's people.
Oh, wonderful. What a blessing indeed. And I wish we could talk a little bit more, but that's all the time we have today. But thank you so much. It is a great blessing, and the services you're providing, helping families on an incredible level. And I'm looking forward to some more episodes on that so that we can dive deeper into how we can approach mental health. So on that note, family, that was rich. A huge thanks to Dr. Jill for helping us think biblically and practically about mental health, caring for the whole person with wisdom, courage, and compassion.